Disaster can strike unexpected, anytime, anywhere, inside or outside the country, including far oceans. Poverty can lead to radicalization of young people and has contributed to the events of the Arab Spring. The United States government is involved worldwide as a global force. We have faced many cultures beyond our experience and dealt with gender and age issues. We have been to many dangerous places with emerging infectious diseases requiring the development of new resources. We're still at risk from old diseases such as malaria and new forms of multi-drug resistant tuberculosis. We have engagements at the tactical, operational, and strategic levels. The Defense Medical Language Initiative has sought the advice from subject matter experts on the value of language and cultural training in global health engagements.
Our U.S. military operates in 24 time zones, basically 7 days a week, and the engagements that we undertake, whether they be from combat to humanitarian relief, involve consistently understandings of the cultures where we work. It could also be just developing partnerships in Europe. It could be developing future capacity in Africa. But in every case, language is key. It's critical that our forces have, when they're engaging in a long-term engagements, that they have a general understanding of the culture they're working in, and even more specifically, some basic language capabilities. What you're doing is really groundbreaking, and that's what I hope that our office, the Defense Language National Security Education Office, can continue to participate in these kind of cutting-edge types of programs, such as the Defense Medical Language Initiative. It took us a while to figure out the fact that physicians and medical personnel working in theater should have a cultural understanding. Your profession is one of the most respected professions in the world across cultures. The problem is when you come into theater, there's a lot of expectations put on your profession, and they expect you to understand because they revere you. And unfortunately, many times when people come into the cultures, they're shocked that perhaps this expectation is not met. So culture is key in training our medical professionals. In the long term, however, from a professional standpoint, I really believe that we have to look towards training our undergraduates who then go on to medical school or military service in languages and cultures. It's a huge deficit that our schools and our colleges do not turn out the kinds of levels of professional skills and languages that we should be.
Language is extremely important, but I think even more important than language is understanding culture. And when I say culture, I don't mean business etiquette culture. I mean really understanding the culture of the people you're interacting with. I think through that understanding is how you can be most effective in whatever your mission is that you're been tasked to do. You need to respect that culture, you need to be humble in your interactions with them, and you need to listen, you need to be empathetic at all times. And if those three things will serve you well no matter what the culture is. So being adaptive is really about always questioning the norm, always having good sensing mechanism in the environment that tell you what's going on so that you know if you need to take a different action. So training for adaptivity really is about putting you in that mindset, putting you in the mindset where you're always thinking about what is happening around me, what is different today about from yesterday. Is what I'm doing achieving the results that I think it needs to be achieved? Those are the questions that you ask yourself if you want to be adaptive. Medical professionals on the ground, be they public health or be they practitioners, I think are force multipliers and can really do a lot to change the perspectives of the people that you're helping, to show that people from the United States really do care about them as people. What may work for the Americans in coming in, doing something and then leaving really is dependent upon, is a culture amenable to that type of engagement? And my experience is that a lot of cultures are not. They expect you to be there all the time. They expect you to engage with them. They expect you to show them that you care, that you love them in an agape way. So I think that's really what this sustained engagement model is about. I think you're going to see a continued emphasis in the Department of Defense in that particular area. I like technology, but I also think that this type of stuff requires human-to-human interface. What I do think technology can help you with is getting over the basics of interpersonal relationships. So if you need to learn something about a culture, then you might be able to use a technology to help you understand how you need to behave.
Over the past decade, the Department of Defense has shifted from a very strong primary focus on combat operations to a much more balanced scope of missions between combat operations and non-combat operations, such as stability operations, humanitarian assistance, and disaster relief. Health actually has some very specific and critical cultural awareness requirements. We did some academic research into the issues of what needed to be accomplished in terms of training for our health professionals and what was the best way to meet the requirements. Some of the elements that are unique to the DMLI program that don't exist in many of the other language and culture programs that are not focused on health is a look at the system within a country, the health system within a country. How is it structured to provide the support for the population in the country? It was almost impossible to develop the technical fluency within a language in order to communicate about health and scientific issues at a very effective level. And that led us to the conclusion that unlike some other areas of engagement with health engagements, it was important for us to improve our skill at use of interpreters or translators when we were engaging with the host nation population. Our initial tasking was to develop a training program for U.S. military people going into Iraq, because we were heavily engaged in rebuilding the health infrastructure that Iraq had enjoyed for decades. As we developed that curriculum, the U.S. military emphasis shifted to Afghanistan, and we were able to develop that training curriculum also. And so now our task is pulling together those common elements and those educational objectives to build this framework so that wherever the U.S. military may go in the future, we will be able to more quickly bring in some specific regional experts and health experts and develop a training program for the U.S. military people going to that region.
Having cultural competence and some language ability is very essential to medical stability operations. We deploy around the world, and we're a force in readiness and oftentimes first responders. And as we hit the ground, including with our medical programs and assets, it's very important to be able to interact in a positive manner with the local culture. And from a medical perspective, our first principle is to do no harm. And if you don't have the proper cultural competence, you can certainly do harm to individual patients, but also at a programmatic or even a national security level with an adverse cultural incident. So it's essential to us. Well, I think we should incorporate cultural competence and into training for our medical providers at various points in their career, understanding that we're a global force now and that almost everyone in the medical profession will be engaged overseas at some point in time. So we need to look for the various centers and schools and make it part of our career progression. Just as we learn basic life support, we need to learn basic cultural competency, and then depending on our positions, some more advanced cultural competencies, and then region-specific. If you're assigned to a specific area or you know you're going to be focused on a certain country or region, then you want to get more in-depth with language and cultural-specific details for that region. Certainly tracking people who have acquired certain skills, who have been to certain training or have certain cultural competencies based on their deployments or their experience or their own upbringing. That would be very beneficial in terms of making sure we get the right people in the right position at the right time, because these can be very sensitive assignments, very sensitive engagements, and we want to capitalize and maximize our opportunities.
Most of us are not inherently that adaptive and flexible. and that has to be trained, and it has to be taught, and it has to be reinforced over the course of a career. You really don't have much time to spend learning a language, learning about other cultures. It becomes very difficult to blend those two. They really are not synchronous in a day-to-day work environment doing primary care type of encounters. And that's something that we need actual policies written on, because once the policy is in place, then there'll be more latitude, more ease given for doing that. But until that's a recognized, quantified, measurable requirement, that will drive then the latitude to do the training, do the redundancy, and get it embedded in the culture and get it institutionalized. Change the training now, so that we're doing adaptive training right now rather than waiting for the next conflict to go back and figure out what we did right or what we are doing right now. So that really is probably the biggest challenge from an MHS perspective. If you are caught in a no-notice movement to an area you've never been in before, how much culture do you need to have versus how much language do you need to have? And I think all of us need to know the pleasantries, the greetings, you need to know the general cultural norms, but I think most of us would say that you need to put more of your effort towards the culture. You get more bang for your buck by knowing how not to offend, how to integrate, how to engage. And I think that sometimes gets lost. That strategic concept and planning gets lost when you hit the ground and you feel guilty when people start to die because you have not personally moved out fast enough and hard enough. There isn't an entity out there that's already doing this planning that has all the answers. We don't have one cache of that knowledge and experience that has been given the authority and the responsibility to develop the training and to do the planning and be the home base for this, to be the lead, to take this in to the next step.